Hey everyone, it's Dr. Rick with an Herbal 411 highlight. So I have some patients that are just entering into exercise, and I think resistance bands are fair game as far as how to break into this exercise routine. There are benefits because it's easy. You can bring this anywhere, pack it. There are several different bands you can use to increase resistance. When you apply resistance to any arc of motion or movement, you will cause some tension. The muscle will have to overcome the resistance of the object, whether it's pushing a sled or working against elastic. My dad used to have this chest expander. It was just springs that you would kind of pry apart and get a good workout. Using springs, elastic, gravity, or friction is fair game because you can get a workout in. Now the question is, how do you apply that for an overall exercise routine? And the first thing I'll say is that you have to decide on what your target goal is. Is it to be stronger? Is it to optimize muscle strength and endurance? Is it to lower glucose? Is it to lower your LDL cholesterol? Or is it to lower your blood pressure and heart rate? All those things have to be considered together as ingredients to your final recipe. If you're not sure where to go, then you need a coach to do that for you. So if you don't have a coach, or you don't have any idea what you're doing, or if your physician is not giving you the proper guidance on how to take care of your disease process with natural therapies like exercise, diet, mindful practice, then you can consult me from any part of the world on my Herbal 411 website. I'll put the link down below. I'm gonna break this Herbal 411 highlight into two lessons. First lesson is, how do you use a resistance band? There's many different ways to apply force or resistance to a movement. I think when you're first starting out, it's important to go through big regional movements more so than small bodybuilding movements. Reason being, if you apply your resistance bands to one tiny body part or one muscle group like the bicep, there is a slightly increased chance of developing tendonitis, but I think you should be fine. So in the case of a bicep tendon, you have to anchor your resistance band to some immovable object. At this point in time, I had no poles in here, but I do have a foot. I've wrapped one loop of the resistance band around my foot, and I'm holding the other hand. So if I get into the right position, I can get to full contraction. I think the best thing is to not swing. If you're going to choose one muscle group, then you keep your elbow in one position and you just go to a full contraction. So all we're doing with this is working this bicep muscle. The bicep is connected to the shoulder and the elbow. So at full range of motion, which is full extension now and full flexion now, you can get a little bit of a workout. The only restriction with resistance bands is sometimes, depending on your anchor, you might lose all the tension at the extremes. So full extension, I'm not really feeling a resistance. Full flexion, I'm not really feeling resistance. I can feel it right here at the middle of the movement, which is fair. And that's one of the limiting factors with resistance bands, is you can certainly continue putting more and more bands on or getting the tightest bands or shortening the band. But I think there's a ceiling to that versus working with iron, working with machines. You can essentially pile on more resistance as you progress forward. That's the name of the game, is to optimize on cardiovascular fitness in addition to muscle strength and explosive power. Now, some of you will say, I don't want to be a bodybuilder, I don't want to explode, but those are just other training techniques to optimize on muscle development. The more optimized your musculoskeletal system achieves, the better you'll be at fat burning. And a lot of us have a little bit, 10 to 15 pounds extra because of COVID. In addition, you'll also trigger better function of your mitochondria. If you're a long hauler, then you probably have a little bit of mitochondrial dysfunction due to the big fight that you had with the COVID infection. I can certainly give you herbals and supplements to reignite the mitochondrial function. Why not just try exercise, proper sleep, and nutrition? So for more of a regional movement, I'll just demonstrate what you would be doing with push-ups or bench press. Both of those movements can develop your chest, your shoulders, your back, and your core. So for the bench press movement, pretend you're holding a broomstick and start in a shoulder retracted position, and then start to move forward away from body. This is the movement that you can develop just like you're pretending you're pushing a barbell away from you or you're doing a push-up. Now, the problem, as I stated before, is that if I'm used to pushing resistance in iron and I do these certainly will be a little bit of a different movement, but if you do enough of these as you're beginning, you will get to the point where you'll fatigue the muscle group, and that's where the building starts. Fatiguing your regional muscles can develop lactic acid. With lactic acid, you'll have the stress response. With a stress response, your muscle will rebuild over the next 24 to 48 hours and hopefully be stronger than before, or at least more efficient. Efficiency of energy production, or ATP, from the mitochondria is important to exercise. Every cell you can exercise the way it converts over energy. One of the biggest problems, whether you have fibromyalgia, chronic fatigue, long hauler syndrome, is that the mitochondria have been so exhausted from the infection or the inflammation that they just don't know how to work anymore. Same thing with breaking an arm or a leg. When you're put into a cast and immobilized, that extremity becomes very tiny because muscle degenerates. If there's no stimulation to the region or the specific muscle groups, then they'll atrophy. And for those of you who say, I don't want to get big, I don't want to get muscular, I don't want to look like a bodybuilder, I don't care about muscle size, I consider the musculoskeletal system that's fine-tuned has an extra gland. And if the musculoskeletal system has a gland is dysfunctioning or not utilized, you're missing out on a natural way to control disease process progression. And if you just take the metabolic part out of it, you don't care about diabetes, you don't care about cholesterol, you don't care about blood pressure, not utilizing muscle with its full range of motion and power will bring on contraction of a joint, muscle atrophy, and joint pain. Think of when you wake up in the morning and your back is hurting, your knees are hurting until you get warmed up. I'll probably do another video on proper warm-up or the need for warm-up later. And as we go from regional movements, like upper body, lower body, you can get into finer tuned movements like deltoid lateral raises. Wait, this is an overhead press that develops deltoid strength. You have to be careful that you do these things properly, and perhaps a physical therapist should show you first. Now, part 2 of this is to learn about breath. There is a way to link breath to movement. I'll give you 3 basic techniques for figuring out how to link breath to movement. In yoga, when we call out the transition between poses, we always link it to breath, so that the ultimate expression is that you have worked your body in addition to calm the mind. With breath, you have inhale and exhale, but you also have pause and hold. A lot of my power lifters will choose to take a deep breath in and hold it like a Valsalva maneuver, and then complete the movement like this. Take a deep breath in, hold, and breathe out at the finish of the movement. Take a deep breath in. When you're taking a deep breath in for the movement, you're holding the diaphragm in one place, the anterior abdominals, the obliques, the lumbars, and then the pelvic floor. This becomes an enclosed cylinder, a power box that connects the upper body strength with the lower body explosive power. So essentially you have less chances for overloading the low back. Some people will say as you hold that Valsalva maneuver in and release at the top of your movement, that time period when you're holding the breath in can increase intravascular pressure and then give you a stroke. If you don't have any problems with aneurysms, I think you're pretty safe. We'll base it on the fact that most of you are beginners and you're just starting with this process, and that's just one way of breathing. The previous way is holding. Second version of breathing is holding. Breathing out slowly at the crux of the movement. In the bench press, you'll see some people literally blowing the weight away or the ground away. I think that gives you a sense of power and explosiveness. If you've ever watched a boxer hitting a bag or people in the ring, you'll hear them do this. And that's letting up a little bit of air at the top of the movement when you connect. The theory is that you're still keeping the cylinder intact, but you're letting go of a little bit of air and pressure at the top of the movement. The third technique is where you don't even worry about Valsalva maneuvers. That's probably the most basic way to learn about linking breath to movement. So for those of you who are using resistance bands as your entry level into training, that's fair until we hopefully get COVID controlled even better and have the gyms open up. And the beauty of the Endorphin Effect Training Center is that not only do we have resistance exercise, we have boxing, we have jiu-jitsu, we have yoga, we have cycling, and there's usually going to be a coach around during the day to give you advice on what to do if you have a question. Do the best that you can to progress forward within the resources that you have without getting injured. If you have any questions, put them in the comments down below. Otherwise, stay healthy. I'll see you at the next video.